Once a related tumour is found and a diagnosis of MEN2A is confirmed, patients are referred to a specialist endocrinology team to begin treatment. Blood and urine tests, as well as scans of the neck and abdominal area, are carried out to check for tumours. If tumours are found, surgery is usually required. Almost all adults and children with MEN2A will need surgery to remove their thyroid gland and surrounding lymph nodes. Without this surgery, almost all MEN2A patients will develop medullary thyroid cancer by the age of 40.
I was diagnosed in the September and I started going up to the hospital in the October and December to see the endocrinology team and also to talk to the surgical team. And I had a total thyroidectomy and then I was given the results 3 weeks afterwards when they then told me that I had actually had C-cell hyperplasia and medullary thyroid carcinoma in the very first stage, and it had been totally removed. So I was very fortunate and my surgeon was very pleased how the surgery had gone.
Even after tumours are successfully removed, those with MEN2A will need to have regular blood tests and scans for life to check for any disease recurrence or new tumours. 2 years after Laura's thyroidectomy, her calcitonin levels began rising and scans revealed that her medullary thyroid cancer had spread.
I've had 5, 6 lots of scans and I've got three here. They think that's where they are because of the calcitonin. They can't find it anywhere else because of the PET scans, MRIs and anything like that. So likely they are there. They're not growing rapidly and the calcitonin is gradually creeping up. So that's where we are.
So the prognosis that they gave me was really good. They did tell me, however, that I needed to continue coming up to the hospital to be reviewed and that I would be seen by the head and neck team on a regular basis post-surgery for a review. I haven't had any more scans, but I've had quite a full range of blood tests since surgery through the endocrinology team.
As well as cancer in the thyroid gland in the neck, tumours can also occur in the parathyroid glands that lie close to or within the thyroid, and in the adrenal glands found above the kidneys. A tumour growing in the adrenal gland is known as a pheochromocytoma, or pheo for short. Around half of people with MEN2A will develop a pheo. This will require surgery to remove it.
When I was about 30 years old, I had a call from one of the medical team, one of the endocrinologists, and he had read some research that had said that not every single pheo shows on urine tests. And he said it made him think of me, and he said, I'd really like to get you in for an MRI because all of your urine tests are clear. So he said, I just thought of you and I'd like just to check it out. So I went in for an MRI and there it did actually show a tumour in my right adrenal gland. So at that point they said, okay, so we're going to have to get the right adrenal gland removed. So I went to a different hospital for the actual surgery, and I did bounce back really, really quickly from that surgery. And I have lived really, really healthy, happy, well life without the right adrenal gland.
However, 17 years after her initial surgery, Mandi began to experience headaches and fatigue, so she contacted her endocrinologist. Tests revealed a small pheo on her left adrenal gland. Surgery to remove her remaining adrenal gland will mean Mandi becoming steroid dependent.
When I was told that I did have a very small tumour in the left adrenal gland, I was told the adrenal gland would have to come out at some point within the next, they said within the next 5 years it will have to come out, and that therefore I'd be without adrenal glands. And because of that, I'd be what's called steroid dependent. I'd have to take steroids every day to make sure that I, stayed well, stayed healthy. When I first found out how serious it is to not have adrenal glands, I was scared. But with the amount of reading I did and research I did, it really empowered me to realise that first of all, I can deal with it and I will be able to manage it because I'm quite meticulous in how organised I am. I've got my medical alert band, I've got a steroid dependent band for when I have surgery, I've got a little bum bag that says steroid dependent. I've got as many things ready for the time that I will be steroid dependent, where I can keep all my medication. So if I get the call to say, right, you're in surgery next month, I'm ready to go.
People like Mandi, Liz and Laura learn to live with the uncertainty of MEN2A. Regular tests and scans, the possibility of further surgery, and a reliance on medication for life can be unsettling. This is why ongoing support and access to information is vital.
Regarding any potential further surgery, I've found out about the fact that could be a possibility through having the literature from MEN2A and being part of the support groups, obviously listening to people that have had far bigger surgery, if you like, than what I've had to go through. I'm hoping I don't have to.
Yeah, the thought of having surgery again is not pleasant. I didn't expect to have more surgery. Obviously I'm older now, and the thought of having this cut here and it's near a nerve and it's near an artery, it worries me. It worries me a lot, but if it has to be done, I'll obviously have to have it done. But I'm more concerned now than I've ever been.
I think I would be naive if I didn't worry about living without adrenal glands. And I don't want the concern to be the overriding thing. I want the overriding thing to be the positive thought that my future will carry on being good. My uncle is in his 80s, and it just shows that with MEN2A you can live a really long life. And me, my cousins, their children, we all live healthy, good lives.